Outpatient total joint procedures are one of the fastest growing areas within orthopedics. In order to support ambulatory surgery centers interested in adding total joints, Arthrex has partnered with some of the most progressive ambulatory surgery centers across the United States in creating the Arthrex Arthroplasty Showcase Centers, or Arthrex ASCs. These Arthrex ASCs have been performing outpatient total joints for as long as 10 years.
Just the pure number of total joints in the next 15 years are expected to grow to over 3 million. So just the efficiencies that are needed in the total number, the need of ORs, creates an opportunity for surgeries being moved into outpatient setting.
There are a few reasons we became interested in outpatient joint replacement. One of them is clinical, in the sense that many patients simply don't need to go to the hospital for the procedure and they'll be fine going straight home. The other is the patient experience that we felt we could improve on by doing this at the surgical center instead of the hospital. And the final is economic, in the sense that we felt we could deliver this care at a lower cost than with standard inpatient techniques.
I started doing outpatient total joints and partial joint replacements because I feel it's a good experience for the patient. There's a better environment, I feel like, in an outpatient center as opposed to inpatient center like a hospital.
The patient experience when undergoing an outpatient total joint replacement usually starts with a clinic visit. We then have the liaison reach out to them, set their expectations, answer their questions.
We like to communicate with the patient as soon as possible. When we're notified of a booking of a total joint replacement, our joint team hops on it and communicates with the patient and lets them know the importance of coming in for a patient tour and education.
I'm a registered nurse, and I did need a total joint replacement of my right hip.
My knee was giving me plenty of problems. I had discomfort walking, pain, and some pain at night, and it was about time that we did something to cure it.
My doctor and I both decided that it would be good for me to stay, so I did stay the 23 hours, and then I was released early in the morning, and it was a very smooth transition. I don't remember having much pain at all.
After preparation, they took me for surgery at 7. I woke up about 10:30 in the morning. I was back in the car at 11 o'clock and home at 11:15 that morning.
Once you get home, you're solely relying on your PO meds. And so my husband was there to make sure that I was taking them around the clock, at least for the first 24 hours.
We used mostly just a aspirin type product and very, very light pain meds once in a while when the swelling was hurting. I was never in pain, I was just in some discomfort.
Patients are responding great to the concept of hospital-free joint procedures. Many patients are surprised that it's a possibility, but when we ask them about it after the procedure, after their experience, many of them say that they can't imagine going through this any other way.
If we can put the patient's concern ahead of the surgery, I think it's a better experience.
Most patients don't want to be in a hospital. If you ask a patient where they want to go, they'd much rather be in an outpatient setting where they get to go home either that day or the next day and get that more personalized care. So I think patients have responded very well to this experience.
Our patient satisfactions are really high, 98% above. The operations start on time. The whole process from the preoperative time all the way up through surgery and the postoperative process.
I think visitors will see a well-integrated team approach. They'll see from the medical assistant down through the surgery center a team that's giving proper education to patients. They'll see a courteous staff. They'll see that a clean environment. They'll see all the benefits that you get at an inpatient setting with a much more boutique, small experience that patients are happy with.
Overall, what we're trying to do compared to the hospital is give the patient the control. We're empowering that patient. We're giving them choices. And with that in mind, I think the patients have really embraced this option.
Arthrex ASCs are truly pioneering hospital-free total joint procedures. If you're interested in visiting one of our Arthrex ASCs, please coordinate through your local Arthrex agency.